depending upon the degree of weakness of the kidney, we classify the chronic kidney disease into various stages. So generally they are classified into stage 1 to stage 5 on the basis of how much blood the kidney is filtering, or as we say, what is the glomerular filtration rate or GFR of the kidney. There's an added classification on the basis of presence of protein or albumin which is leaking in the kidney, because when the kidneys become weak, the filtration also becomes weak and you get a stage of A1 to A3 depending upon how much protein is being leaked into the kidney. So for the diagnosis, to say that a person has chronic kidney disease, you look at two things. You try to estimate the GFR and you try to have a look at the urine for how much protein is leaking. So based on the basis of GFR, if the person has a normal GFR, that is 90 to 120, but he is having some protein leakage in the kidney, or if on ultrasound you are seeing some structural damage to the kidney like a cyst over there or a scar over there, you will say this person has stage 1 chronic kidney disease. Stage 2, stage 3, stage 4, stage 5 of chronic kidney disease are depending on the decline in the GFR. So once the GFR declines to between 60 to 90 ml per minute filtration capacity, it is called the stage 2 kidney disease. 30 to 60 is considered as stage 3, 15 to 30 is stage 4, and less than 15 is stage 5. Similarly, depending on the degree of protein leakage, it is A1, A2, A3. So if the albumin leakage is less than 30, it is A1 stage, 30 to 300 is A2, and more than 300 is A3 stage. So this is how you try to classify the stages of chronic kidney disease. While these may be important, for what you have to understand is that what are the connotations. So early stage like a stage 1 or a stage 2 kidney disease, you have very minimal abnormalities because kidneys have a lot of reserve. So the person is totally asymptomatic, they don't have any symptoms, and these stages can be detected only if they are tested. While stage 3 is also sometimes called as the cardiovascular stage of kidney disease, that kidney person may not be having any direct symptoms related to the kidney, but the symptoms may come in form of high blood pressure, they may come in form of person developing some cardiac issue, and then when you assess the patient, you find the kidney was the cause, one of the causes which contributed to the cardiac issue. It is in the stage 4 when the GFR is less than 30 that the patient really start becoming or showing symptoms of kidney disease, and stage 5 when the GFR is less than 15 is also called the stage of kidney failure, when you have to start planning to go for what we call as renal replacement therapy, that now the kidneys will not be in a capacity to sustain the body's function properly, and you have to think of dialysis or kidney transplantation.